Hey, Dr. Mike here. Today I want to talk a little bit about what I call the permanent versus transient subluxations. So subluxation is the thing we treat. It's the imbalance of the spine. It's one or more segments of the spine out of alignment, creating problems with ligaments, tendons, muscles, but primarily your nerves. If there's an imbalance of the spine, it will affect your nerve system. And so these are the things that we talk about, subluxation. So the imbalances that we have, a lot of my patients, especially my adult patients, have had subluxation or imbalance since they're very little. Quite frankly, most of us have been imbalanced possibly since birth. So the birth process itself, in utero constraint, slips and falls. They say the average child falls about 1,400 times before they master the art of walking. Soccer practice, soccer games, falling out of a tree fort, slipping on the floor. All these things that happen when we're real little, when we're little boys and little girls, set the stage for a pattern of improper alignment. So the body heals, but it heals wrong. And like the old saying, as the twig is bent, so grows the tree. This is what happens into our spine structurally. So if we don't get checked when we're young and get these ameliorated and fixed when we're young, they develop permanent patterns, and we develop what I call the permanent subluxation complex. So what I tell patients who come in when they're in their 40s, 50s, 60s, and 70s, and they've got tons of degeneration and arthritis and herniated discs, that they've had some of these imbalances since they're really little. And those we manage. So once you develop arthritis, once you go beyond the phases of degeneration that become more permanent, we manage those. We help those to not get worse. We try to save everything that's left that's in good shape, but those are the more permanent. The more transient ones are the ones that happen within the last decade or two. Once you go back beyond 2 decades, it gets harder and harder because those imbalances are really patterned into the spine. But the newer, more transient ones, let's say from an accident, a slip or a fall, poor posture, different work conditions, different sleep habits, those can be corrected, fully corrected, because they're more transient. They're newer subluxation patterns. So I hope that makes sense for you. The key to remember, though, is that when the nerve system, when the spine becomes imbalanced and it becomes out of alignment, it's really easy to correct when you're young, right? So we talked about the young stage of subluxation. I had a newborn in here just this morning. And when you look at a newborn, if you look at a baby in a car seat, you will notice sometimes that the head tilts one way. And it always goes the same way. And that's a sure sign of imbalance. That imbalance is right here at the occiput and atlas, and it's a very easy adjustment to correct that. Very gentle, done with the pinky contact. The sacrum is the second bone. That's the foundational bone at the bottom of the spine. And that bone also typically goes the opposite way of the atlas. Typically what I do with the newborn is just a very simple adjustment of the atlas and a very simple contact to redirect the sacrum to a better place. We don't crack babies. We don't, that's not, people say, well, why would a baby need to be adjusted? They're not in pain. Well, this is why. This is foundationally why a baby should be checked, because in utero constraint, the birthing process itself. I also had a pregnant woman in today who's got a breech baby, and we're doing the Webster technique in an attempt to have that baby go down into the vertex position to be born vaginally as she chooses. And a lot of times what happens is in utero constraint and the birth process itself, if any of you women out there have had a baby, 80 pounds of compressive force is a strong contraction. That's a lot of force on a baby's head, right? So those kind of compressive forces, the in utero constraint or imbalances that exist in utero, those are the first subluxations that we see. If we can get them early, catch them early, we could correct them. And then there's no permanent subluxations for that child growing up into adulthood. But most of us, unfortunately, have never been educated as to why spinal hygiene is even a thing. We learn about our teeth, we learn about nutrition, we learn about exercise. Nobody teaches us about spinal hygiene. And that's really my goal and my purpose in my life, is to teach you guys that the spine is something that is permanent. You don't get a second one. There's no baby teeth to adult teeth. It's just one spine, and when it goes, it goes. So I hope that helps. I hope you get adjusted. Stay informed and do that. Come see us, get adjusted.